Good afternoon. My name is Majella Beattie. I'm the founder of Care Champions, and I really want to welcome everybody here today. Care Champions are a family-led group who represent the families of residents in care settings across Ireland. Our work began during COVID, when families were excluded from care settings. Family life provides more than love and support. It provides protection. We ensure that good care is delivered, and if care standards drop, that our loved ones are protected. The interruption to family life during COVID-19 caused a decline with dementia. The loss of family protection meant oftentimes that poor care was not observed, as you will hear from the stories that will follow. We have supported more than 2,000 families with concerns around the care of their relative. We have assisted almost 100 care staff who have contacted us with concerns around poor care or abuse in their service. We have a support service for bereaved family members, and we are advocates with lived expertise. We watched as nursing homes across the country introduced visiting restrictions that were in excess of those of the recommended by public health teams. Government policies and guidance, which were ignored by some care settings without any sanction, failed our residents and they failed us. We met with government ministers and we called for action. Among other measures, we have called for adult safeguarding laws and a public inquiry to learn from the lessons of COVID in care settings. We do not want any tokenistic or clinically led inquiry. We want a transparent public inquiry led by a human rights expert, conducted through a human rights lens. Related to the focus of today, we have called for residents to have a legal right to see the people they love through the Care Partner scheme. This scheme is in place in Northern Ireland since September 2020. We simply ask for the same things for our relatives that each one of us here would want for our future older selves. All of us, regardless of age or where we live, should be able to live safely and with access to the ones that we love. I want to ask everybody here today to do something for families and residents. If you have access to Twitter, please tweet and share stories with the hashtag CareChampionsDay. Please note, a petition with our call for Care Partner is also available to sign. The fact that we raise a negative experience of care in no way negates from the excellent care received by many people in many care settings. We believe that such care should be consistent and available everywhere. Unfortunately, as our experience shows, this is not currently the case. We are most delighted and honoured to have the wonderful Brendan Courtney, who himself has personal experience of the care system, to act as our MC today. Please give Brendan a big welcome.
Thank you, Majella. Thanks very much. Good afternoon. I'm going to keep this very short because we've a tight time. We've an hour and a half to get through all these incredible, difficult stories. And Ken here, who is one of the volunteers, will hold up a little when you have a minute left to speak, because we want to hear, everybody's made the effort to come today, we want to hear all their stories. I probably have the most public story of care. I did a documentary about my dad trying to navigate the Fair Deal system, which is still, Fair Deal for home care is still being piloted, it's still not there. And unfortunately my mother now ended up in care about 6 months ago, and in Clontarf, and we had no access to her, and she had delirium, and we had a terrible, terrible time with it. So, I mean, just to say, on behalf of everybody, you know, you don't say no to Majella, right? Majella is amazing, and just called me cold out of the blue. So I'm honoured to be part of this. I nearly crashed my car when I heard RTÉ News talking about this event today. So congratulations, and a big round of applause for Majella Beattie, please. Well done. My care experience continues. My mum is at home now. We have navigated a care system for her. So I have a T-shirt now that says, "Mam's fine." Everybody just asks, "How's your mother? How's your mother?" It's very glamorous. She's doing great. So thanks very much, and I'm delighted to be here. So we'll get straight into it. The first off, we have a letter from a man called Jim, and Jim has written a personal experience of his time in nursing home care during the pandemic and not being able to see his family. And Jeanette Coyle is here to read on his behalf today. Please give Jeanette a round of applause.
Thanks, William. Hi, everybody. So I'm just going to start off the day sharing Jim's story. So Jim is a nursing home resident and shares that during COVID, he felt very isolated and abandoned. So here we should see a picture of Jim somewhere. Will pop up, yeah, smiling and happy before COVID. So he could not travel to be here today, so he very much wants his voice to be heard to prevent others from experiencing what he went through. So he wrote out the following piece, which I will read out to you. It touched us so much that we purposely left it as he wrote it rather than typing it out. So I'll just read it. So in Jim's words, "I missed my family so much during the pandemic. I went from having a visit every single day from one of my daughters and my wife most days to having no face-to-face visits at all. I am not good with the mobile phone, and I also suffer with hearing problems. I lost touch with what was going on in everyone's lives. I felt very lonely, but also lost. I got very down during this time. It seemed endless, never-ending. I never want there to be a time again where anyone in charge tells me that I cannot see my wife, especially my wife. Sorry now. Or my children and grandchildren. I felt like I did not own my own life, like I was not a person who had any value, like I counted for nothing. This was wrong. It should never have happened before, and it should never happen again." So Jim's words are very impactful. The lines that especially saddened me were, "I felt like I did not own my own life, like I was not a person who had any value, like I counted for nothing." And so obviously there's a lot of nursing home residents are still feeling like that today.
Thank you so much. Can I have a lovely big round of applause, please, for Jeanette? Please give a round of applause. Thank you so much. That was well done. You did a brilliant job, and Jim will be very proud. Our next speaker lost her mother in a hospital setting, and she's here to tell us a story. Please welcome Fidelma Mansfield, please.
My name is Fidelma Mansfield, and today I'm here to tell you about my mother, Elizabeth Mansfield. She was a sister, mother, grandmother, great-grandmother, and an amazing friend to many. During the lockdown, she enjoyed her crochet and singing. She was amazed at all the likes and comments she had on the Facebook sing-song page. I was my mother's full-time carer. She cared for many during her own lifetime. My mother depended on me for her hearing aids and daily needs. My mother wasn't feeling well at the end of April. On advice of her GP, she needed to go to hospital for tests. She did not want to go, and now I wish I could have helped her to stay at home. My mother was a proud, independent woman, and with our help, she walked to the ambulance. This would be the last time we saw my mother in person. For 24 hours, we did not know where our mother was in the hospital, with no visiting and no one answering phones. Finally, a doctor phoned and told me that my mother was distressed and crying in the emergency department, asking why was she there and to go home. I asked if I could visit her. The doctor said I could not visit, as visits are not allowed. My mother was able to contact family members on speed dial on her phone once charged. I was going out of my mind with worry. Was there enough staff to attend to her needs? If only one person was allowed in, not only would it take the pressure off staff, it would have brought a little humanity and dignity back to those who suffered alone. I was told that my mother was very frail and could pass away, followed by a call to say that my mother would be moved to a nursing home for respite. I strongly refused this, as COVID-19 was rampant in the nursing homes and families were locked out. The next call I received from a different doctor was to tell me that my mother was unresponsive. He could not wake her up. He said that he would make arrangements with staff as to what would happen next. I was so upset with all my heart, wanted to be with my mother. The guidelines allowed for compassionate visits at end of life, and this was denied. An hour later, my mother phoned me. Her voice was low, but she asked me what I was doing. I was shocked considering the call I had just had. We were now totally confused and even more concerned. When ringing the ward to ask how she was, we found that the staff who answered appeared not to have clear information on my mother's condition. They seemed not to know that she was as sick as I had been informed previously. Then I received a phone call from another doctor. He told me that my mother had improved and he was planning to get her home. I was so happy to hear this at long last. In hindsight, it was one contradiction after another, and nobody knew what the other was saying. On the 11th of May, it was my mother's birthday, and she was disappointed that she was not going home that day. But we knew that she was be coming home in 2 days' time. I was busy getting the house ready for her. I then got a call and was asked if I would take my mother home without a care package, as it could not be organised in time. I was just so happy that I was finally getting her home. I said yes, absolutely. I asked if I could please come in to see her for her birthday with a cake. I was told that she would try her best to get me in and just ask for her when I got to reception. I had only put the phone down, and within seconds, literally, it rang again. My joy was cut short. I was asked by this doctor if I was driving. I said no. I said no. She said, I'm sorry to say, your mother passed away 20 minutes ago. I was numb with shock. When I asked to take my mother home less than a minute earlier, she had in fact already been dead for 20 minutes at least. I was assured that a doctor and 2 palliative care nurses were with my mother. I cannot understand. When they knew she was passing, that nobody rang me immediately. Staff and our family. The shocking lack of communication on the ward itself between colleagues is extremely concerning. I was told that I could now go in to see her. They would leave her in the ward she passed away on, or they could move her to a separate room. I was so upset. I was denied the right to see her when she needed me. I could not go to the ward as I was a risk. How was I less of a risk now that she was gone? I was too distraught to go to the hospital, so arrangements were made for her to go to the funeral home as soon as possible. My mother, like so other many others in hospitals, were let down and nursing homes, and it is only by a human rights-led inquiry that we will prevent this inhumanity happening again in the future. A dedicated phone line should have been in place for everyone whose family members were taken to hospital alone. No phones were being answered. I would like to ask Health Minister Stephen Donnelly, in memory of my mother Elizabeth Mansfield, to consider putting a better system in place for families contacting hospitals. I would like to thank all the people who have supported me and to you for listening to my story today. Thank you.
Well done.
Well done, Fidelma. Our next speaker sadly also lost her mother on the 1st of February during the third wave of COVID, and she wants to share her story as well with us. Christine Brown, please. Thanks.
Hi, my name is Christine Brown, and I lost my mum, Kathleen Thompson, to COVID in a Cork nursing home on the 1st of February 2021. So Wednesday will be her second anniversary. So my mum basically, she was my best friend, absolute heart of gold, just the most gentle, caring person that you could ever meet. So basically on the 31st of January, I rang the nursing home just inquiring about my mum in general because I hadn't seen her all that week due to visiting restrictions. And the person on the other end of the phone told me that she'd had a very bad night and that she was on oxygen. So I questioned them and I said, I think you have the wrong person. I'm asking about my mum, Kathleen Thompson. And he said, yes. Are you Christine, her daughter? She's got COVID. So that's how I found out by accident that my mum had tested positive for COVID. So they wouldn't let me speak to a nurse or anybody to give me any more information because they were too busy. That 49 out of 50 residents had tested positive and to ring back the following morning. So I rang all that following morning, which was the 1st of February, and the afternoon, as did other members of my family, only to be told by the reception that somebody will ring you when they get a chance. And eventually I did get a phone call that evening to come out. Well, not to come out. The first one was, we're just ringing you to tell you that she's not doing very well. Keep her phone on. And I asked them, can I come out? Can I be with her? And they said, no, just keep your phone on. So I rang the rest of the family, and my brother and his wife decided to drive into my house, and just as they came in, my phone rang again. And it was the nursing home. Said that you need to come out. So they wouldn't. I asked them, can I please come in? Is my mum dying? Just come out. And then another phone call, bring an umbrella, because the same night it was storm conditions. And by the time we got to the nursing home, I ran to the door, and there was all agency staff after being drafted in that day. I found this out afterwards because nobody knew even why we were there. They didn't know who we were. They didn't know who my mum was. They weren't even informed that we were coming out, that my mum was dying. We didn't know at that stage that my mum was dying. We still didn't know what was happening. And eventually somebody came out and said, go around the back. And we did. We went around the back. We were standing out in the rain and the wind, in the dark. For a good 10, 15 minutes, nobody came out to us there. And my brother had to go around the front, tell them that we're out the back. Is there somebody coming out? I was looking through all the windows. All the curtains were closed, trying to see my mum. And eventually somebody came to the side door, opened the side door, said, I'm sorry. My brother then asked him, just please let Christine in. Just let her be with our mum. And he said, no, I can't. And then he opened the curtains in one of the rooms of the window, and just my mum was lying dying. So there was 9 of us had to watch her die through a closed window for over 2 hours in a storm. And that's why I'm here today, because no family should ever have to go through that, to watch their loved one die alone. And not one member of staff went into that room to her that night. And that's why I'm here today, just to highlight the call for the full public inquiry. And for a care partner to be introduced, because people don't deserve to die like that. And just a huge thanks, Majella, for everything that you've done for us. So thanks.
Well done, thank you. Thanks, Christine. Now we're going to hear from a care worker who worked in private residential care throughout the pandemic, and he's going to share some of his experiences. Mitchell Ryan, everybody.
Just before I begin, I just want to say to Christine Fidelma, as someone who was on the other side, I'm very sorry for your loss and sorry that happened, please. My name is... Thanks. My name is Mitchell. I used to be a care assistant in nursing homes, and I've left since COVID. I've seen both the good and bad sides of COVID, of nursing homes during COVID. During the pandemic, I worked in two. The first nursing home I worked in, the management and staff were doing the best that they could, even though it was still challenging in the aspect of COVID and lockdowns. When someone showed symptoms or tested positive, they were moved to a specific corridor instead of being locked in the bedroom. If anyone tested positive, they were put in that corridor. They could mix with teeny shells and have social interactions. Unfortunately, though, there was still very little visits for families. I have seen many circumstances similar to yourselves, and once again, I'm sorry for that. I couldn't imagine being yourselves in that situation. I worked as a carer and an activities coordinator, and the biggest problem I noticed was the lack of interaction with other residents during COVID, and interactions lessened with family. We did our best with video calls through tablets and whatnot, but at the same time, like Jim, many of the residents, technology was a barrier and not a help. And I've lived away from my family. Talking through a phone is not the same as talking face to face, and it helps. We had residents who would watch the news every day, and obviously during COVID it was on the news, death tolls and everything, and we had problems with mental health. Anxiety went through the roof with residents, and we had to try help with that, and there was only so much because staff were also going through it. We had families to go home to. We had high-risk family members as well, and we were worried about bringing PPE, lack of PPE. Were we going to contract COVID? Unfortunately, some of us did. I myself had COVID. I was out of work for over 2 months. But we had the best we could in that nursing home. We set up visiting pods with intercom systems so families wouldn't be standing out in the elements like yourself, Christine. And we did our best with activities. We had concerts every Wednesday through Skype. We had lovely community around us that would help out. But unfortunately, I also worked in nursing homes that were the other side of the coin, where management were very different and support was very different. I worked in one nursing home where it was very systematic, institutionalised almost. We would have 7 care staff on a good day for 70 plus residents. And credit to the staff at the time, but we're only human. There was only so much we could do for each resident. There was often days we wouldn't have the numbers to get residents up out of bed. They would be left in bed, and because of this, bed sores would appear. If anyone doesn't know what a bed sore is, it's where someone has been left lying in a certain position for too long. And I have seen many over my time, but I had one where we could see the hip bone. It was that bad. Unfortunately, as COVID continued on, we got less and less PPE gear, less and less care staff applied. The job wasn't, people didn't want to work in care, so our numbers dropped. There was often times I had to sit with family members and residents as they were passing away, and that is something I will never forget for as long as I live. Since then, I have left care and aspect. I no longer work in it. I had a mental health break myself because of it. I ended up having to get professional help, and thankfully it was there. But I know many carers who are still in the system that haven't got help. I was lucky I had support of my family and friends. But with 7 care workers for 60 to 70 residents, it's not possible to provide adequate care. And dignity is something that lacks for these residents because of this. And I could no longer go into work and not be able to give my best, so this is why I left. The impact we endured while working with people during COVID had an awful impact on many people, myself included. And in order to fix the crisis that is in caring, caring has been made an attractive career. I'm not talking through financial. People that care for others, they're not doing it for money. They're doing it because they've had family members pass away, or they just want to help people. I myself grew up helping my grandmother, and that's how I ended up getting into it. But it needs to be made attractive through proper management, proper care for staff as well as for residents, and PPE gear. The amount of times I put on PPE gear and it would rip, and then you're wondering, what's the point in PPE gear at all? So today I want to add my voice for the call of Care Partner and for a human rights-led inquiry. Families and residents are entitled to be listened to and have answers given, and the people who live in care homes are they deserve dignity and respect, and that's why I'm here, because I found dignity and respect lacked, and that's why I'm here today. So I'd like to thank Majella.
Thanks, Mitchell. Well done. Staying with care assistants, our next speaker has worked in a HSE residential care setting and wants to share her experience, but also her concerns about her experience there. Margot Hannon, give her a round of applause, please. Thank you.
Thanks. Hi, my name is Margot Hannon, and today marks nearly 1,000 days since I became a HSE whistleblower. I'm here today largely thanks to my husband Anthony, to whistleblower aide John Ty, to Care Champions founder Majella Beatty, and to Legal Aid Caoimhe Haughey. I will share briefly my experience with you publicly for the first time and why I'm supporting a human rights-led public inquiry into the handling of COVID-19 in Irish nursing homes. I was a HSE healthcare assistant for 16 years in a large nursing home. During the first wave of the COVID-19 outbreak, I witnessed breaches of HSE infection prevention and control policies, non-adherence to clear and established HSE and HPSC COVID-19 risk assessment guidelines and HIQA national standards. These directly impacted the health of more than 60% of our entire resident population. In addition, 75% of total staff were reportedly affected. Sadly, many of the residents died. The health impact on those infected and the high death toll in the months that followed remains unknown. A few examples of the breaches include the confusion over whose role it was to identify, isolate and test residents with typical COVID-19 symptoms. I witnessed residents with typical symptoms not being identified for COVID-19 and not being isolated. Therefore, staff were denied PPE. Nurse management were adamant that only those with fever were to be identified. Therefore, those with cough and shortness of breath were not isolated. According to nursing management, it was the doctor's role to identify for COVID-19, not the nurse's role. Senior medical management, on the other hand, believed it was the nurse manager's role to identify those for COVID-19 testing and felt only those with 2 typical symptoms should be identified, not those with 1 symptom. Senior medical management, acting in an infection control role, instructed staff not to wear a mask for patients who were coughing if the ward junior doctor did not think the cough was a COVID cough, but instead to take a step back. Nursing management and infection prevention control staff supported this view. When 7 residents were finally officially identified for testing by nursing management on my ward, they were still not isolated and staff concerns were ignored. There was no infection prevention and control outbreak preparation plan evident. Isolation areas were assigned after transmission was generalised, more than 3 weeks after the first outbreak was declared. Residents who were sick with typical symptoms in shared rooms were transferred into single rooms in other wards with healthy residents and not properly isolated, increasing the rate of transmission. After the outbreak was declared, there was a significant delay of 3 weeks to lock down affected wards and buildings, allowing free movement of staff and residents until transmission was generalised throughout the campus. Staff felt unsafe, and I and many staff voiced same. Residents were scared and feared for their lives, and rightly so. For a number of weeks, families were not contacted or informed that COVID was on site because senior nursing management believed it would only worry them. The 2-year independent investigation that followed the protected disclosure was by a Crooks Consultancy Limited, commissioned by the then Minister of Health, Mr. Harris. 2 of the 3-person panel were senior HSE staff, but it was deemed to be independent of the HSE. It took 2 years for a 500-page report on preliminary findings and recommendations to be submitted to the HSE Commissioning Manager of Investigations, Yvonne O'Neill. A Crooks informed me that the report has been submitted to key parties for clarification purposes to ensure if there is any piece of information that for some reason wasn't provided that might alter their results, their findings. Nearly 3 years on, the preliminary investigation report is still at what the HSE call the clarification stage and is being considered, according to Ms. O'Neill. I met the investigation team again nearly 1 year ago. The chairman said our meeting concerning the findings was not being recorded and that I was to keep what was said confidential. All I can say today is I received a helicopter overview and my concerns were largely validated and collaborated with the evidence presented on site by staff and family testimonials. I was assured there should be key learning with regards to what I disclosed for the HSE. They said families' voices would be heard. Today, however, nearly 1,000 days on, neither families nor staff voices have been heard. In conclusion, and this is my main point today, I strongly and confidently believe a national human rights-led public inquiry is warranted, and grieving families deserve no less. The future reform of the healthcare of older people begs for accountability of systematic failures and a reflective, transparent approach similar to other countries like Canada, for example. That is my hope and the reason why I am obliged to be here today. Human rights do not grow old. Thank you.
Margot, well, they're hearing your voice today. Big round of applause, please, for Margot Hannon. Well done. Well done. So next up, actually, from Northern Ireland, we have a care campaigner who's going to tell us about their campaign in Northern Ireland to have a care partner scheme, but also the introduction of the care partner scheme and how it's working. Martina Derry, give a round of applause, please. Beautifully timed, Martina. Thanks very much.
I'm just going to go up here, if that's okay. Hopefully I don't break anything down here. Can everybody hear me okay? Yeah. Okay, thank you so much for the invite, Magella, and it's lovely to be here. It's very emotional, you know, obviously hearing everybody's story. I have one of my own as well, but I have a couple of pictures up here, and the one at the very top left-hand side, sorry, I'm trying to navigate paper here as well, is my beautiful mum and myself just prior to the pandemic. So I live in Northern Ireland. My mummy actually was from the south of Ireland. She was one of 14 children in a 2-bedroom house, so pretty much a traditional Irish family. So she's from sort of just outside Carlingford, if anybody knows that area. So Galtram's land, up in near the Cooley Mountains. So I'll give you a little bit of background to myself, if that's okay. So I started off when my mummy went into a care home in 2013. and I had got some families together in the care home. So it was a care home of about 60 residents, and we decided to start up a relative support group. And it was all very informal, nothing formal at all. So we would have just met every couple of weeks and every quarter, and we always had a formal kind of meeting in a local hotel, which was great. And there was lots of different experience, within that group. There was somebody who was a social worker, somebody worked in the health and social care trusts, and I work in IT, so I have nothing to do with health and social care at all. But and then one of the husbands of a resident, he actually was one of the commissioners in his former day. So we had lots of different experience. If something went wrong, we always knew, we could rely on each other, especially around processes and procedures and things like that in care homes, because there's so much of it. So anyhow, the 23rd of March came in 2020, and that was such a devastating day, because prior to that day, I would have visited my mum a couple of times every day, sort of dealt with her personal care and hygiene. I would have put my mum to bed every night. That was just the routine. And then that day came, so it was all kind of hands off. However, it didn't kind of stop us, because our family went to the window, and luckily my mummy was on a ground floor. So my heart breaks, for those residents that were on a second floor, third floor, because their families wouldn't have got to see them like we got to see my mum on the ground floor. So we went to her window a couple of times every day, and then my husband and I went to the care home every night around 9:30, 10 o'clock, and that was for the full 9 months, when lockdown started. But a little bit of history around this. In July 2020, my mummy was hospitalised, and it was nothing actually to do with COVID, it was to do with a seizure, and she had a history of those. So she went to Craigavon Area Hospital, and that was my first time being in her company after, 15 weeks of lockdown. I have the word neglect up here. So when my mummy was in hospital, she was in hospital for 2 weeks. But I couldn't believe the state of her personal care and hygiene. So I had asked, because I knew the procedures. My mummy went back to the care home, and I asked the care home and the local trust to carry out an adult safeguarding investigation. So neglect was confirmed around my mummy's personal care and hygiene. Then in September 2020, the care partner guidance was introduced in Northern Ireland. And it was a really positive idea on paper. So me being me, I contacted the care home, and I said, what are the care partner arrangements? So I'll come back to that in a moment. So in the meantime, in August, sort of through to October 2020, I decided, after seeing my mummy and seeing the neglect around the very, very basics of care, I contacted a human rights lawyer in the north. And I said, society has opened up. I can't believe the state that I found my mummy in when she was in hospital, and I want this challenged through the courts over the visiting restrictions. So I started taking out a human rights legal challenge. For a couple of reasons, it was delayed until the October 2020. I had spoken to the director of the care home, once the care partner guidance was introduced, and all I got was, it's likely going to be the following spring or summer. Now, I was horrified, but I knew in the background, I'm going to challenge this all through the courts. So then in December 2020, we buried my mother-in-law, who was battling cancer. And then the next day, 23rd of December came, I got a phone call from the care home. Again, nothing to do with COVID, which is what I thought. So the telephone call had said my mummy was being rushed to hospital. She had high heart rate again, my mummy had a history of that, so I didn't think anything different, and I go to the hospital again. And then she passed away 2 weeks later. And it was only after that that I requested my mummy's hospital records. And I noticed in her admission form that my mummy was going into hospital with suspected COVID. Now, I kind of thought I'll delve deeper just to make sure that I've read the correct information here. So I requested the 999 call, which is normally made from a nursing home, to the Northern Ireland Ambulance Service. And part of it was redacted, but I could see my mother was clearly going into the hospital with suspected COVID. Now, we all know everybody's got a duty of care. Anyhow, I have been campaigning for Care Partners in Northern Ireland, and I'll pick this up later on another slide. But I am one of the Bereaved Families for Justice Northern Ireland group. I'm not sure if you've heard of us, but I'm one of the 2 campaign leads for that group. We are actually part of the UK COVID Bereaved Families for Justice group, and that group has got about 6,000 members in it. They're an absolutely amazing group of people that I've met. I'm actually part of their central campaign team. Now, this is the group. There's a photo up there, the third down. It's the wall with all the red hearts. I'm not sure if you've ever seen that on TV. It's all over social media. I mean, it's the wall, you know, across from Westminster in London. And this is the group that I'm part of that has put Boris Johnson under that much pressure. He has called a UK-wide public inquiry, which includes, thankfully, Northern Ireland, England and Wales, Scotland and Wales. So we have been campaigning long and hard for a public inquiry. We were looking at our own devolved public inquiry, but I am grateful that we are having one, even though we're part of the UK, because I will make sure that, you know, our families are heard. So we've been granted core participant status, and if anybody here is from the legal field, you'll know that that means that we have a legal role in the public inquiry. So there's 130, just to put that into perspective, there was 130 groups in Northern Ireland, across the UK, 130 groups that applied for that kind of status for the first module in the public inquiry. And only 30 groups were granted core participant status by the chair of the inquiry, who's a retired judge. And there was only 3 groups in Module 1 from Northern Ireland, and our group was one of those 3. So we feel that that's a huge achievement in itself. So that has started from last year. But like most people, we all know across the island of Ireland, you know, there's been so many public inquiries. But we are just really hoping for, you know, some kind of accountability. I would hope that lessons are learned should we face another pandemic. And I really want to see a legislative change. I want Care Partners, you know, legislated, because nobody in care homes or in hospitals should be left on their own without a family member. At the end of the day, we are their eyes and ears. We are actually the experts. So you've got specialists out there, but we're the experts, families are. Could you just go to the next slide? Yeah, sorry. So a little bit about Care Partners. Like I said, it was a really good idea. It looked good on paper. It was introduced by the Department of Health in Northern Ireland, and it was published in September 2020. I believe it came about because of the pressure from the public. It was really introduced to respect human rights of residents and their families. It was somebody who had somebody could be a care partner who had a long-standing relationship with a care home resident. So that could have been somebody like myself, you know, with my mum. It could have been somebody, a son and their mum or father. And initially in the guidance, it was allowing up to 2 care partners per resident. And that's how the guidance started off. It was to provide support. So what kind of support was that? That was emotional support. It didn't mean that you had to go in and feed the person. You could go in and feed the person if you wanted to, but it was really, but you could also go in to hold their hand. That's the emotional support that was part of it. Psychological support or physical support. It was really a risk assessed and risk managed approach. So all the risks were looked at by the experts within the Department of Health and Public Health Agency. There was a difference in care partner visits and normal visiting. So normal visiting was done at a distance, like 2 metre social distance. Care partner visits were a little bit different. You could provide, go in and hold their hand, you could provide up close and personal care if you needed to. Can you just move to the next slide, please? Thanks. So care homes in the guidance, when it was first introduced in September 2020, it was given them about 6 weeks to implement it, which I thought was a pretty reasonable time frame, given that we had been locked out of care homes for about 6 months at this stage. Families campaigned though, so I was one of the lead campaigners that went to Stormont that first year in 2020, because what we found is, some of the care homes were not letting care partners in, and one of the reasons they said they weren't tested. We were happy to be tested, at the local testing centre, but that wasn't enough for some reason. So we decided to campaign. The media was behind us. We had a lot of media support, which was great. And then we went back a second year to Stormont, and we did that in November 2021. Even though my mummy had already passed away, I knew families were still going to windows, which I thought was absolutely shocking. There was no need for that because we already knew from the care partners being introduced that it was a risk-assessed and risk-managed approach. So then they started to change the guidance again. But just initially, when care partners was introduced, there was no testing of the care partners at that time. So we continued to campaign. And what we had reported back to the Department of Health and the Public Health Agency was that, care homes are locking families out because they're in an outbreak, or the surge level in the country, has changed, and we need the guidance to change. So they did change the guidance, and that last line there says that it had changed on the 15th of January 2021. It was too late for me, and my mummy. My mummy had passed away a couple of days, before that. But I know other families, it has hugely benefited, in the north of Ireland. Just want to move to the next slide, yeah. Thank you. Can you all still hear me okay? Yeah, that's okay. So what was the reactions of care home providers? It's probably fair to say it was a bit of a mixed bag. Some wanted clarification from the Department of Health or the local health trust. I know my mummy's care home wanted clarification when it was first introduced. I thought it was very clear, in the guidance. But some care homes felt that it wasn't. Some implemented it very successfully, and some didn't encourage care partners, whilst others did encourage families. Funding was provided to support visiting, and what I discovered, after my mummy passed away under a Freedom of Information request, was that some care homes were actually getting paid by the state, but yet and all, they didn't allow families in. So I would like to think that that will come out in the public inquiry, because funding is one area that will be looked at in the public inquiry. I'm nearly on my last slide. Yep. I'm getting eyes here that I'm running out of time. So we're on the last slide. Yeah. So care partners today, it does help families access their loved ones, which is great. I personally feel that, our group, even though we're small and informal, has made a huge difference to many families and residents across Northern Ireland. If we find a care home is not compliant, then it would be reported to the Department of Health or QIA, which is the equivalent to, I think it's HIQA in the south of Ireland here, and the Public Health Agency as well. Some families are enjoying unlimited access, which is great. That's the way it should be, because we know we've got all the critical tools to make this work. The risks are all assessed, and they visit, every day. Some of them visit a couple of times every day, which is great. Some families are still restricted, but what I've said to them before is, it's really important that families stay informed. You've so many people that you can turn to for advice. Please don't be afraid to ask questions and challenge equality, because every life does matter. One of the other points I wanted to say there was the last 2 bullet points on that slide. Even though Care Partners was introduced in September 2020 in care homes, when my mummy was being admitted to hospital, I remember saying to the nurse on the COVID ward, I'm getting into the COVID ward because I need to be with my mummy. I'm my mummy's care partner. Now, I used that line genuinely thinking that I was my mummy's care partner, even though I didn't get into the care home, but I was getting into the hospital. But I didn't realise until February 2022, it was only extended to all the hospitals in Northern Ireland. However, I got in December 2020. So thankfully, I was there with my mummy, in her dying days and weeks. So one last point I want to do make. I've spoke to Majella a couple of times, and I was asking her, is the structure in Northern Ireland similar to Southern Ireland? And she had explained to me that, yeah, about 80% of your care homes here are, private, in the private sector. And it's a little bit more, actually, in Northern Ireland. We've 90% of the care homes that are private care homes. But they're also state funded. And I looked into human rights and things like that when I was taking out the challenge. I was actually on the phone to the Human Rights Commissioner of day one. But when they are state funded, they're known as public authorities. And when the state tells you that, the discretion is left with care home providers, well, we all know that discretion must be monitored and it must be proportionate as well. So just bear that in mind. So thank you again for inviting me today.
Inspiring stuff. A great ally. Thank you so much. Round of applause again, please, for Martina Derry. A great ally. Now, a volunteer with Care Champions who's actually caring for her mother in a nursing home setting at the moment is going to light a candle and read a little poem. Karen Heffernan, everybody.
Memories of loved ones, like stars in the night, shine brightly in our hearts, guiding us to the light. Through joy and through sorrow, they are with us still, etched forever in our minds, a love that will fulfill. We hold the dear laughter, the love and the tears, the memory we treasure to the passing years. They are the ties that bind us to the ones we hold so dear. In every memory, we find a piece of them, a smile, a touch, a laugh, a love that never ends. And though they may be gone, their lives live on and on. In every memory, we keep them forever young. And now we'll have a minute's silence to remember those we lost. Thank you.
Thank you so much. Now, since the start of the pandemic, social workers have been speaking out about their fears for the safety and the restrictions were causing on residents, particularly in care home settings. And we have here the head of the Irish Association of Social Workers, Vivian Gearan, who's going to tell us more about how he thinks we should have a legal policy-based response to this. So thank you so much. Round of applause for Vivian, please.
Thanks very much, Brendan. As Brendan said, I'm Vivian Gearan. I'm the chair of the Irish Association of Social Workers. And to begin with, I want to thank Care Champions for the invitation to speak at this really important event today. And I especially want to thank and acknowledge the incredible work among so many people, but particularly of the work done by Majella Beattie as founder of Care Champions. And in particular, to recognise and applaud Majella's outstanding and tireless commitment and the deep dedication, energy and compassion that she has brought to Care Champions' work of advocacy, support, education and campaigning for positive change. And that's exemplified in today's event. I appreciate that Care Champions is not a one-person show, but I do want to pay that particular tribute to all that Majella has done and continues to do, and especially to thank her for her leadership in this area of work. Thank you very much, Majella. Moving on to what I want to say in the context of the Irish Association of Social Workers, I want to focus on some key points. First of all, what do we know, including what have we learned from the pandemic? Then, what shouldn't we forget? And finally, what we need to do now. And regarding that third question, what we need to do, there are, I would suggest, at least 3 simple things that I, on behalf of IASW, am urging all of us to focus on now and to ensure that it gets done without delay. And they are, number 1, implement a care partner scheme. 2, hold a public inquiry. And 3, introduce safeguarding legislation. Care really is better when loved ones are there. We are all aware of the really harsh impacts of the COVID-19 pandemic, and particularly how the pandemic, as well as how aspects of our response to it were managed, and how that all in turn impacted so severely on those in hospitals and care homes and their families. And we've heard harrowing evidence of many of those instances here today. Many people died, with residents in care settings being disproportionately represented in those numbers, and we could and should have done better. I believe that what happened also reflected, and still reflects, a pre-existing enduring weaknesses in our health and social care system. Critically, those weaknesses include the lack of safeguards and protections for nursing home residents, the out of sight, out of mind nature of such care in general, and the delayed response, or almost an afterthought nature, that was given to the protection of those residents when the pandemic first broke out. For example, as we've heard, visiting restrictions, while understandable in wave 1 of the pandemic, however, Ireland consistently failed to adopt the creative solutions that opened visiting in other jurisdictions. In Denmark, for example, visiting restrictions were banned in summer 2020, recognizing that people in care homes don't want to simply exist, they want to live, and family life is an essential part of living. Unfortunately, it often seems that in Ireland we have a hangover from our years of institutionalizing people, a paternalistic, we know best approach, which seemed to play out once again in our residential care settings during COVID-19. A certain ageism and related discriminatory practices have resulted in policies that mean residents in Irish care settings have had less access to the people they love compared to residents in other countries. This has caused harm. Families provide more than love and affection. They provide vital support with mobility, nutrition, and personal care that staff cannot always provide. When families were excluded, we saw the impact on the quality of care. Families also serve as a sort of valuable watchdog, monitoring care standards. It is more often than not families in whom residents confide when things go wrong. And we should know, given our history of institutionalization, the risks of creating closed communities. Other countries recognized those risks and moved to restore rights to family care. The Care Partner Scheme is one such positive response which would acknowledge, endorse and support the vital role that families play in these situations. In Northern Ireland, as we've heard, their Care Partner Scheme is not law but is a clear policy and programme, with the Minister for Health warning that adherence to the scheme in the private sector, as outlined by Martina, is essential for continued financial support from government. The impact of the pandemic, we should remember, continues now. For example, residents do not have access to long COVID clinics or their local community physiotherapy, occupational therapy, or clinical nutrition service to support their recovery. A we know best attitude and approach often means that people's needs are neither understood nor at the centre of policy responses. Again, countries that recognise and respect the rights of residents provide rights-based services and responses. Unfortunately, Ireland has a long way to go. Social workers are not the only health and social care professional group who are deeply concerned about safeguarding and the various issues we are talking about here today. But social workers do have a key and leading role in this area. IASW is the professional representative of the over 5,000 social workers registered and practicing in Ireland. Adult safeguarding is a huge issue for us. It is one of IASW's priority advocacy goals, and that is why we published our revised and updated position paper on adult safeguarding last year. We have a special interest group on adult safeguarding, and apart from all the social workers directly employed in safeguarding roles, social workers across all areas of practice encounter safeguarding matters to a greater or lesser extent at different times in their work. IASW has raised issues of concern from the outset of the pandemic, and particularly recognised and spoke out about the hugely negative impact that visiting restrictions had on the physical and mental health of nursing home residents and their loved ones. We also view this impact in the context of human rights infringements under the European Convention on Human Rights, Article 8, on the rights to a private and family life. UCD's School of Social Policy, Social Work and Social Justice, in partnership with IASW and Care Champions, ran 2 webinars in 2021 to raise awareness of these issues and our calls for mandatory reporting of abuse in the context of the lack of safeguards for nursing home residents. Social workers and IASW developed and promoted the resident and family liaison model, which was shown to be effective and helpful in the long-stay facilities that embraced the model. I make these latter points to demonstrate that in among all the negativity and the gloom, there are always positive things we can do, and at the same time, we have a long way further to go. Looking at the bigger, even global picture, it is also worth bearing in mind that family concerns about safeguarding did not and do not exist in isolation. Ireland is a signatory to the United Nations 2020 Statement of Support to the United Nations Secretary-General's policy brief on the impact of COVID-19 on older persons, which specifically referenced, quote, the distressing reports of mistreatment and neglect in older person services, end of quote. Yet Ireland failed to introduce any new safeguarding resources or responses, and our HSE safeguarding referrals dropped by 10% at a time when risk of abuse was accepted and acknowledged by bodies like the United Nations and so many others as being exceptionally high. While the individual and collective human experiences that have brought us to this day and that we've heard about today is laced with considerable pain and loss, I believe we must build a hope and an impetus for action for the future, built on the collective hunger for change embodied in this room, in all of you. How we care for all citizens can be better, and we can and we must learn from the past. Residents, families, social workers, voluntary organisations and other allies have started and now continue this grassroots movement. How will we honour their experiences and stories and the experiences and stories that we're hearing about today? How can we and will we get where we need to be on the issues we are talking about and listening about today? How can we do that? For starters, we in IASW again call on our elected representatives to listen, to understand, recognise and legislate for the rights of residents to do more than simply exist, to live quality lives with access to relevant and quality health and social care services, to live as part of their local communities, and vitally, to see uninterrupted and safely their families who provide irreplaceable and essential care and support, as well as meaning in their lives, in all of our lives. I want to finish now by thanking again Majella Beattie and Care Champions for this opportunity to speak and to listen to you, and by reiterating and supporting the call for an urgent, full, human rights-led public inquiry into COVID-19 deaths, and the introduction of a care partner scheme. I also want to restate the need for all nursing home residents to have access to all health and social care services, including social work support, as and when they need it. And finally, I repeat IASW's primary call, joining with the voice of so many others here today, for the urgent progression, enactment, and crucially implementation of safeguarding legislation to ensure real, strong, and consistent protections going forward. In conclusion, I want to assure you all of the continuing support of the Irish Association of Social Workers in this campaign to ensure that the human rights of all of us are vindicated and that everyone working in the health and social care professions, including social work, are supported to provide the best possible services to those who need them. Residents, and indeed our own future selves, deserve nothing less. Thank you very much.
Thank you, Vivian, from the Irish Association of Social Workers. Now, we just have a few more speakers and then we're going to hand back to Majella. But Age Action is probably Ireland's leading advocacy agency and organisation on behalf of older people. And my family have personal experience with Age Action and they have been incredible. And as you know, Age Action deal directly with what they would call clients, we would call family members, and they listen. And in fact, for many family situations, we've employed Age Action, obviously they're a charity, but they've been absolutely incredible. But they talk to older people and they have loads of research on what older patients are saying at the moment. So the head of advocacy and public affairs is here from Age Action. Please welcome, Celine Clark.
Thank you. Thank you, everybody. I'll tell you, there's no heat going to last in here today, is there? I'm frozen. I'd like to thank you all for inviting me here today, and particularly Majella from Care Champions. And I'd like to take this opportunity to extend our deepest sympathies to all who lost family members or loved ones during COVID-19 and who are still living with that experience, and for those who are still trying to support people who are in residential care or trying to live at home independently in the community as well. And I know from my own experience, both in life and work, that having to come and give your own testimony and tell your own story in a public forum can be very, very difficult. And is also a sacrifice and a commitment and an honour to the people that you love. And I want to just extend and acknowledge our appreciation for you to do that, because I think it is really powerful. And it's possibly something that we have been missing. And in a rights-based approach, participation of people with lived experience is vitally important to informing our policy and influencing our policy. So that's one side. I was told 20 minutes and then 15 minutes, and I think I'm probably on 10 now, given, yeah, okay. So Age Action's vision is for a society that enables all older people to live full, independent lives so that you can participate fully in society. And this really means removing ageism and other barriers from our policies and also from our minds, our hearts and minds, ultimately. And so Majella asked me to talk a little bit about ageing in place as an alternative to residential care. So ageing in place is a stated government commitment. It's been on the agenda since about the 80s, where we are trying to support people to live at home. But living at home requires more than just home care. It requires a myriad of things to be able to live independently in older age. And thankfully, the majority of people who are over the age of 60 do live full independent lives at home, including the majority of people over the age of 90. But there are supports that are needed, and there are barriers, particularly around access to care, having an adequate income to be able to support yourself, having a home in which you can be minded and live independently. And unfortunately, the housing stock for older people is by and large inadequate because it's drafty or it needs home adaptation. So there's a number of things that have to happen in society and in our policy to be able to support us all to live at home independently in the homes in which we've built our lives, or at the very least in the community in which we have built our lives, which means any residential care facilities need to be really built within the community and not on the outskirts where you have to get a bus and you see nobody passes you and you're outside of the community. And that's critically important, and currently we don't have that policy. But we did a piece of research most recently with the School of Social Policy in UCC to understand agency and ageing in place in rural Ireland. So basically, what is the experience of older people living in the community in rural Ireland? Because obviously there's particular challenges if you live rurally, as I do, and I don't drive either, and we don't have children either. So I actually came to Age Action, having worked in climate change, thought that, and honestly, working to combat climate change was kind of easier than working on ageing policy, to be frank. This is a bit of a more challenging experience because I think people don't care as much, and I think that's critically important. We have an ageist society, but also we don't value care sufficiently to value the carer, so the person giving the care, and also the person that is being cared for. And at any point in our lives, we all will need care and do need care, regardless of our age. So in agency and ageing in place, the outcome of the research basically showed us that the majority of people want to age in place, we know that, but the barriers that affect people from being able to age in place mostly was the state of their home. So that was a barrier for them, in that it needed to be adapted and they couldn't afford to adapt it, or the grants that were available to adapt it were insufficient, took too long, and in many cases just wasn't enough money for the person to be able to adapt their home sufficiently to live in it. 84% noted that highlighted accessible and affordable home care packages, which I'll speak about more. So that goes to speaks to the need for person coming in to give home care, whether that's personal care, or a lot of people just need help maintaining their home, and that was the third thing. So people being able to keep up with the upkeep of their home, but also being able to clean gutters, change a light bulb, things like this were important to them, and obviously they couldn't afford it in some cases as well, particularly people who depend on the state pension. And then the other thing that was noted amongst all participants was their experience of ageism. They felt invisible. They feel that they are not the focus of sufficient resources being allocated to their needs when you are older. And that can be also manifest itself in that this idea that Vivian spoke about earlier, that we know best, and that can happen in our families as well. And we have to be really careful that we don't sort of, know better what's right for the older person in our lives and support their decision making, their choice and control over their own lives. And finally, we have the Assisted Decision Making Act coming on stream and the Decision Support Service that will be fully operational. And it's really important that everybody informs themselves, whether you're younger or you're older, it doesn't matter. You're going to need this at some point in your lives, potentially. So currently, the state of care in Ireland is structured, as you well know, along nursing home care, formal care, which is care delivered in the home, and informal care, which is care delivered by family members. I'm sure many of you have experience of all or one of those. At the moment, despite significant increase given by government to the provision of home care services, we still have about 6,000 people waiting on home care. About 3,000 people have been assessed but have no home care hours allocated to them as yet. And then there's about over 2,000 people waiting for additional home care to be provided. And we don't know how many people there are waiting for an assessment. So there's a lot of problems there in terms of, we always used to campaign for more money to be allocated to home care, and now we have a situation where there is a commitment to deliver 24 million hours of home care by the HSE in 2023, but unfortunately we don't have sufficient workforce to be able to deliver it. And the infrastructure in terms of being able to process people through the system is slower than it should be. So these people then are at risk of potentially prematurely going into residential home care. And it's not their stated will and preference. So I just want to touch a little bit around rights and home care. And I thought what Martina was talking about earlier, just to underscore the importance of knowing your rights and seeking information and being able to use that information in a way. And I know our next speakers are going to talk about a little bit more about that, so I won't labour this point. But Age Action has consistently called for a human rights informed inquiry into the situation of an experience of people who lived and died in nursing homes during COVID-19. As far back as the first weekend in March, when COVID response measures were introduced, we immediately began to raise attention to the fact that people who were living in residential care, whether that was nursing homes or otherwise, were at extreme risk of having their rights violated because COVID response measures didn't take into consideration the proportionality of the rights-based approach and ensuring that rights were balanced. And so people's, as previous speakers have talked about, people's rights to privacy, their right to family life, their right to autonomy were undermined or violated in many situations because they didn't have any choice, but they also lacked voice. And it's one of the things that Age Action, in addition to the inquiry, a human rights informed inquiry that we are campaigning for, is the establishment of an Office of a Commissioner for Ageing and Older Persons. There's one in Northern Ireland, and I know it was very actively involved in supporting a rights-based approach to COVID response measures. And in Ireland, when you leave the workforce, or you haven't been in the workforce, but you end up at 66 or older, you lack protection and representation. You've no union, you've no other method of having a representation at government level, and the independence and autonomy and the check that is important can be delivered through an Office of a Commissioner for Human Rights with the appropriate legal framework underpinning them. And we also have an ombudsman for children, but we don't have the same representation for older people. And that again comes back to the point Vivian was raising about the prevalence of ageism in our society. Age Action, works to reframe how we think, feel and act towards ageing and older persons. And we did a public poll, released it in December, to understand, are we ageist? And we are. Essentially, 1 in 4 people experience discrimination on the grounds of age, but overwhelmingly, the majority of us hold at least 3 or more ageist opinions, which is a really strong indicator for saying that you are ageist in your approach and in your thinking. But unfortunately, the strongest age group that demonstrated age-based opinions were older people themselves, and what we call that is self-directed ageism, where they themselves have internalized this constant sort of direction that they are not enough, or that they are undervalued, or that they have enough resources available to them in many ways. And of course, the evidence otherwise is that they don't. And so we really have to do a lot of work to address ageism, and we'd like more government attention pointed towards addressing ageism. It is the decade of healthy ageing, so there's a United Nations framework to support much greater attention to the issues of ageing and older persons, and it includes combating ageism. And as Vivian mentioned, there is a strong international framework there, although we do believe that there should be a stronger and a new instrument, so a convention on the rights of older persons, and many other member states under the UN are working to achieve that. And then just finally, in the context of a rights-based approach to an inquiry, Age Action advocates for something called the panel principles. So the panel principles are a framework basically that is operated at the UN level, and it sort of breaks down what a rights-based approach is. And the first one is participation, and that would mean that there's the participation of those people who are most directly affected by the policy, that they would be involved at the very beginning, so the co-design. So in the context of an inquiry, the people most directly affected, so you and residents in nursing homes, would be involved in the co-design. So at the very, very beginning, not a public consultation when the terms of reference are developed, but in designing the terms of reference and the scope of it. And that also means that you have to have the right information. So the information about human rights or about the legal framework or about government policy has to be available to people in an accessible way. So not a whole pile of acronyms and difficult language to, in legalistic language, but just in something that you and I speak about at our dinner tables, on the bus or whatever. It just needs to be accessible, and that's really important. The second bit is A, so that's for accountability, and this is about monitoring how people's rights are being affected, as well as remedies when they go wrong. So that's already defined, how the thing would be remedied at the very beginning, and the accountability measures. The third thing then is non-discrimination and equality, which is fairly obvious that all forms of discrimination are prohibited and guarded against, and that people who face the biggest barriers to realising their rights would be prioritised. So anyone maybe with disabilities or any of the 9 protected grounds, gender, age, whatever, would be prioritised. And empowerment, which would be everyone should be able to understand their rights and be fully supported to take part in developing the policy and practices. And then the third thing is legality, which is approaches should be grounded in legal rights that are set out in domestic legislative processes, which is a bit more complicated, but you can get expertise for that. And I know we have some in the room, and my time is up. And so I just really wanted to acknowledge the work that you're doing. As I said, Age Action has been across this in a policy perspective for a long time. We've appeared before we made submissions to the expert panel on human rights. We appeared before the Oireachtas Committee. We made submissions to that as well. We shared our speaking time with one family member. This was early on in 2021. We shared our speaking time in front of the expert panel on human rights with Jane Carrigan, whose aunt died in St Mary's, actually, and that was a bit unusual of thing to do for an organisation. It's not me. Oh, it is me telling me my time is up. So I just want to say we will continue to support you and also just to underscore and acknowledge that we're really grateful that you have organised, which is critically important, and thanks to Majella for organising it.
Celine Clark, Head of Advocacy and Public Affairs from Age Action, always talking lots of sense and great advocates. Thank you so much, Celine. Our next speaker has lived experience, but he's going to give us a brief overview of what families can expect from a public inquiry. Ken Irvin, everybody.
Thanks very much, and much of what I've had to say, or I'm going to say, has been said, but I'm going to try to keep to 5 minutes. I was given the unenviable task of timekeeping earlier, so I better behave myself. Right, so Care Champions obviously supports a fully and open and transparent public inquiry, which, as we've heard from many speakers, has to be human rights led. That's so essential. My own experience was really about how the administrative and technical system took over feelings of compassion and love and care for the residents. It became a very technical process under the COVID crisis, which I understand. But for the residents and for the families, it was like a slap in the face. So the families that have contacted Care Champions, they have the lived experience. They have expressed very much the weaknesses and the inconsistencies in the guidance. I also encountered that. A variety of care. Some care is excellent. Care Champions is not saying there is not a good standard of care, but there is definitely a variable standard of care, and at the worst extremes, really quite poor. So we're not castigating everybody in the same light, but we need to pay attention to the standards that we should all expect ourselves and for our families. And that includes, a part of the problem is the lack of power of the regulators, the lack of safeguarding, and all of this leads to a sort of fundamental loneliness of residents. So we need a human rights-based inquiry. The second Taoiseach in the current team for the second half expects an inquiry into to be set up in 2023. The language is welcomed, but it's a little bit too vague for our liking. It's not about pointing fingers, he asks, but it is about getting to some of the home truths and actually making suggestions for what can be improved in the future. And so a public inquiry is about people, and it's about the future people as well as the current people. And many people in this room, unfortunately, may find themselves in the setting of a care home at some time. And we all look forward to professional care and good standards. So a public inquiry is about hearing the voices of residents, families. Many residents, as we've heard from Age Action, are vulnerable, and listening to their experience and to that of the families is essential. So Care Champions demand actually an open and transparent human rights-led public inquiry into the nursing home deaths and care, placing due importance on unsafe practices and denial of residents' rights, which we've also heard this afternoon. And that must be about dignity and compassion of all people, residents, families, and others. And so we have a number of recommendations. These are our highlights. One is a terms of reference to be established by an independent and competent body led by a human rights expert. Crucial that expertise is there in those TORs. Representation from residents, safeguarding social workers, a voice for the families, and an archive of experiences. Let's not forget the experiences that we have just touched on today, but also thousands of people reached out to Care Champions with their experiences. Recommendation number 3 is to address actions regarding the highest standards of care and managerial accountability and not a sort of a separate silo between management and nursing staff. There needs to be connectivity there. And that needs codes of conduct for communicating with residents and their families, and the implementation of an independent safeguarding authority. Fourthly, the development of legislation to uphold the human rights of residents, irrespective of the ownership status of the care facility, whether it's public or whether it's private, shouldn't matter to the care to be expected within those establishments. The recognition of the importance of home carers, and we've heard the experience earlier on, thank you for that, and their condition of employment, training and support, the development and promotion of community services to allow people a choice where they live, and we've heard Age Action advocate for that very strongly this afternoon. The establishment of formally recognized care partners, also a key point, also recognized by the Association of Social Workers, and the creation of a public inquiry, but the creation of a public inquiry should not delay any reforms which are necessary immediately. That's a crucial point. We are not advocating in any way for a long finger approach. There are things that need to change, and they need to change now. And finally, we have mentioned, or has been talked about, the human rights and element, but we will hear a little bit more just when I finish in 30 seconds. The Human Rights and Equality Commission, under Section 35 of the Irish Human Rights and Equality Commission Act 2014, I wasn't even aware of such a thing until I became involved with Care Champions. We require a complementary inquiry where there is evidence of serious violation of human rights following legislation, the European legislation, and following the UN charters that was also mentioned. So with that, I thank you for listening and for attending today's event. Thank you very much.
Thank you very much, Ken. And staying with human rights, from the Irish Centre for Human Rights in Galway, Erin Mord and Muriel Moore will give us an overview of and a summary of human rights analysis and suggest next steps. Give them a round of applause, please.
So hi everybody, my name is Muriel Moore. I work with Mulligan Solicitors.
I'm Quinn O'Maher.
And I'm Erin Nicholward.
So last year we completed a Masters in Human Rights, and we're very proud of ourselves, but thank you. But actually, one of the most important parts of that course for us and for the rest of our group was that we took part in a human rights clinic. And that clinic matched students with community groups that were looking for additional academic support and potential research into the work they were doing. So we paired with Majella and with Care Champions, and we were delighted to do so. So that actually formed a big part of the course that we did, and it was a very practical aspect. So during the course of the year, throughout last year, a number of the students conducted interviews, in fact, with a lot of you who are here today and some additional people. And then we studied the transcripts of the interviews with reference to human rights. And what we read and what we heard really provoked serious cause for concern from a human rights perspective. So as other people have said here today, the Irish Commission of Human Rights, IREC, are the body who are designed to be the watchdog for human rights. And as soon as there is a violation, even if it is in a private facility, it has an obligation to investigate. And later, I know there's another session with families and people concerned. We're going to share with you a letter that we have drafted with Care Champions that we intend to send to IREC to exhort them to put in place an investigation into human rights, with the additional positive that it's a permanent body. so that it will not only call out violations of human rights, but it will also monitor change. And that's what Care Champions is about today and constantly. It's about progress. It's about monitoring progress, and it's about bringing about change. And we're very happy to be part of that. So the rights that we're going to talk about today, we're going to go specifically, the next slide, yeah. The right to life, the right to not suffer torture or humane treatment, the right to liberty and security of the person, to private and family life. So Erin is going to go in a little more detail into each of those. Thanks.
Thanks, Muriel. So first, next slide there for me. Thank you. First, we're just going to consider the fundamental human right to life. So in accordance with this right, the state must protect the right to life, investigate alleged breaches of this right, ensure that there's an effective regulatory framework in place to safeguard the right to life, in context including healthcare settings and residential care facilities. And it must also take practical steps to prevent the loss of life where it knows or ought to know that there are risks to this right. So Quinn's going to read an excerpt from one of the interviews that we did, which raises concerns in regards to this right.
All right. This is just one excerpt from our interviews, which raises concerns in terms of the right to life. He was really unwell. He had said to me, "I'm dying. I don't know what's wrong with me. I don't know what's going on here, that I'm going to die." And he said them words to me, and I rang them, and they said, "No, he's normal. He's just fine."
So moving on to look now at the prohibition of torture and inhuman or degrading treatment. This right is absolute, so under no circumstances may there be exceptions made to this right. Degrading treatment can be characterised as treatment which causes anguish and humiliation, and this need not be intentional to be characterised as such. So in the context of detention, the European Court of Human Rights has found that failure to provide opportunities for fresh air, for recreation, for contact with the outside world, this does engage the right to be free from torture and inhumane or degrading treatment. And the state has a clear obligation to protect vulnerable people, such as those who live in nursing homes, from such treatment.
Right. This is just one excerpt from one of our interviews that raises concerns about the prohibition of torture, inhumane and degrading treatment. The practical care stopped. I'd find out later from a whistleblower staff member that mom had a really bad bed sore, going from her back down to her thigh, that it was bleeding. It looked as if the skin was eating itself. The staff member asked for it to be tested for MRSA. It looked that bad, and the director of nursing literally said, "That's just the skin breaking down. There's nothing we can do. Put moisturizer on it." She wasn't giving any extra pain relief that we know of. So, she had a very painful ending.
So moving on now to consider the right to liberty and security of the person. In social care settings, this can look like continuous control, restrictions on your ability to leave, and a lack of free and valid consent to being in detention. And while it may be permissible in some circumstances to restrict this right in order to prevent the spread of infectious diseases such as COVID-19, restrictions must have a clear legal basis, and they must be used only as a last resort. And detained persons, they have to know at all times why they're being detained. They have to have access to legal assistance at all times, and they must be able to challenge the restriction of their rights in this regard.
All right. This is just one excerpt from our interviews that raises concerns about the right to liberty. She didn't like that she was locked in. They were her words. Yeah, she would be in her room for, days and days on end, sometimes up to kind of 3 weeks at a time, if there was any outbreak at all.
The right to private and family life then, so this encompasses a lot of really important elements such as the touch on personal dignity and autonomy. It encompasses the development and maintenance of personal relationships and familial relationships, a person's home, communication and privacy rights, as well as physical and psychological well-being. So again, these rights may be restricted in certain circumstances, but these restrictions have to have a clear legal basis. They have to be absolutely necessary and they must be proportionate.
This is just one of our excerpts from our interviews that raises concerns about private and family life. And my dad didn't do well on his own. Nobody does. We're human, we like, and we need human contact, you know, and when we would see me, he would just know everything would be okay, and I would fix everything, and I would see who I needed to see to get things done, and yeah, I wasn't allowed in. He said that to me on many occasions when he was really sick and he thought he was going to die, he said, I just don't want to die on my own. And presto, that's exactly what happened.
So finally turning then to consider very briefly the right to equality and to non-discrimination. So everyone has the right to be treated equally, to not be discriminated on grounds such as your age and any disabilities or medical conditions that you may have.
This last interview excerpt we will share is from a family member who still believes unfair treatment of nursing home residents is continuing. I do believe that this is still going on in a redacted nursing home. I do believe that. These people are not being treated fairly. They are not being treated like people, like individuals.
So, on the basis of the serious human rights concerns raised as part of these interviews, and some of them that the participants have raised here today, we, along with Care Champions and so many others who've spoken today and others as well, we're calling on the Irish Human Rights and Equality Commission to exercise their powers to conduct a dedicated, public, human rights-based inquiry into the experiences of people who lived in nursing homes and died in nursing homes during the pandemic, and their families, and people who work there as well. So thank you so much, everyone, for your time. I speak on behalf of all of us when I say it's an honour to be here and to participate today. Yeah, thank you.
Thank you so much. Incredible work. Quinn, Erin and Muriel, thank you so much. And now that concludes all of our talks today. It was really inspiring. It's really quite incredible to be in this room. Something amazing is happening in memory of all the people that we've lost. And for want of a better phrase, the shit's going to hit the fan, isn't it, Majella? Can I have a massive round of applause one more time for Majella Beatty, please?
Thank you. What can I say? That was just such a powerful hour and a half to listen to, and it really flew by. And I know it was really, really challenging for many people to come here today. This morning, within our loss group, and people messaged me privately, families are sitting in their cars and they were not able to come. Families who were bereaved nearly 3 years ago and are still traumatised by what they went through. And while we talk about what families went through, more importantly, the people they lost, what did they go through? And that reflects back to what are we doing now to make sure people will never, ever go through what these families have gone through. We have been really privileged to hear these stories today of the impact of what is happening in some care settings, along with the absolutely excellent expert presentations that we've had. We are extremely grateful to you all, to Jim, Christine, Fidelma, Margot, Mitchell, Martina, Vivian, Celine, Erin, Muriel and Quinn. I would also just like to thank all the Care Champions volunteers, friends and allies who have made today possible and continue to support people every day. I would also just like to take an opportunity to say thank you to the Alzheimer's Society, the Irish Association of Social Work, Age Action, NHQI, and all the co-signatories on the petition, which is available for everybody to sign. We want to say a massively huge thank you to Brendan, who has kept us all on track and made the conference an event to remember. Residents and patients are living with the consequences of policy choices implemented by the government. Yet, their experiences remain unheard until today. We will use our voices and we will remain vocal until residents and their right are protected in law. Policies do not protect them and will not protect our future older selves. Today, we call on Taoiseach Leo Varadkar to announce a human rights-led public inquiry. And we call on Minister Stephen Donnelly to urgently enact a legal care partner scheme and adult safeguarding legislation. Please add your voice to ours and join our over 9,000 followers across social media platforms to speak up for your future older selves. I want to say a huge thank you to everybody for coming, for giving your time. There is tea and coffee downstairs. You can also just walk around this way. And we look forward to talking to the families afterwards. Thank you very much.